Hello and welcome back to my channel. My name is Sabrina Phillips, and on this channel I give you the tips to skyrocket your nurse career. I'll be giving some budget travel tips as well, and I'll be talking about hair at some point. But for those that are new here and those that don't know me, as I said, I'm Sabrina Phillips. I'm a mental health nurse and I am a service director working with the NHS clinical commissioning groups, voluntary care sector, as well as the local authority. And in today's video, I've got some exciting news. It's about how I know there's a number of people that are on the channel that are from overseas in India and different countries. I've asked questions about how they can come to the UK to practice as a nurse or even in healthcare. So I've really got some exciting news for you today. I am going to pull out my notebook because I have been doing some reading just to give you this information. And just to note, I am not a lawyer. I'm just letting you know the information that's there to support you if you want to come over to the UK to practice as a nurse or healthcare assistant or support. The health and care visa, which I understand replaces the tier 2 visa, and basically it's there's been changes, or there will be changes in the next few weeks, where care staff are being added to the shortage or occupational list, and it's in response to pandemic pressures. So this is going to be a temporary change in terms of adding this new healthcare support worker to the health and care visa, and it's so that they can boost the recruitment of staff to our social care or workforce, which is really good because, as we know, there's been lots of pressures on workforce during the pandemic. However, one can weigh it up because in another way it's going to, maybe take staff from countries that need staff, but it's really fantastic opportunity for people that want to come here and give really good high quality care to patients and potentially continue to stay on, because it offers a route into settled status in the UK. There is some minimum requirements for this. So I understand that there would be a minimum salary. So whichever job you're going to be coming to the UK to do in the health and care sector, especially for social care, you need to be making a minimum of £20,480 to qualify. And it also allows for you to come with your dependents. If you've got a spouse and kids, they can come over as well. Also, this change to the visa, there's a reduced price to pay, or reduction in the fee for the visa. Also, it's fast track, so understand that you could get an outcome within 3 weeks of your application. So it is exempt from what is called the immigration and health surcharge, which means that it reduces your outgoing costs for coming over. That one of the conditions of working in an NHS, or what we call a care quality commissioned regulated service, or CQC regulated service, you must have the COVID vaccine as a condition of deployment. So, and this is mandatory as of the 1st of April 2022. So for those coming over, if you haven't had your jab, as we call it, you need to have it by the 1st of February, and your second jab, or fully vaccinated, by the 1st of April to work within the NHS or any sector that is CQC regulated. So just to be aware of that, and there's support that will be offered as well for people that are coming over to be supported to have the jab if they haven't. Is what I understand and what I read. So I will put links to all of this in the description box, and I might put it across the screen as well, because what I want you to do is to read up for yourself and to see what you need to do to be able to qualify for the standard occupational classification code of roles, and this will tell you what roles are in scope of this new change to the visa. And again, that this will be included in the link that I will put. So there's roles such as care assistants, care workers, carers, home care assistant, home carer, support worker, or people that work in nursing homes as well. So it's not only for National Health Service or where you work in the hospital, but also applies to working in care homes as well. The other thing that's really exciting for me about this is that the government is committed to working with the care sector, because they recognise that care work is really important, especially during the pandemic. We have seen that we do need our carers because they've been able to support us to take care of the most vulnerable at what has been a very, very difficult time. But also for me, because this channel is about how I work with you or give you advice on skyrocketing your career, they're also focused on the training for people that are coming over, but also ensuring that there's a proper career structure as well. So if you might come over as a healthcare assistant, you might come over as a junior nurse, but there will be support in terms of your training and a career pathway for you. So you can use all the videos that I show on here to help you, to get your basics, but to move on and think about how you get to where you want to in terms of your career progression. So for me, that is so exciting. So there is an eligibility criteria, which I will put up here. So it gives you an idea of who's eligible. But also, what you need to do is, before you apply for this visa, you need to have a job offer from a UK on the link in the description, and I'll give you a bit more information about what that means. Of the places that you can get a job offer, as I said before, the National Health Service or organisations that are providing medical services for the NHS, or organisations that are providing adult social care. So that's whether that's nursing homes, etc. It says that if your employer is not currently approved, they can also apply to be a sponsor. So that's up to employers to do, but it's just to be aware that they can apply to do that. If you have a job offer in the UK, what would happen is your employer will check that you're eligible for this visa. They will then issue you with a certificate of sponsorship to prove that you have been offered a job. This is an electronic record, and within that there's a reference that you'll need for your visa application. Also, you must apply within 3 months of getting the sponsorship certificate. So from your job offer, you need to apply within 3 months of getting it. I mentioned before the salary is £20,480, but please be aware that if you're applying for different health roles that this visa applies for, there might be different annual going rates for the different roles. So again, please read the information or in the link. For the NHS, they expect their roles are done in bandings, and again, I've done a previous video to tell you what you can expect for the different bandings in the NHS. I must caveat it with it's from about last year, but it gives you an idea of the basics, because since then colleagues have had I think a 1% increase. So I will do an updated video around that. The other thing I'd want you to have a look at is I've got some videos that gives you advice on how you can apply for jobs and how you advice on what you need to do, think about in your interview and the application. And I think it would help, because if you haven't applied for a job yet and you're going to apply, these will be really, really helpful in terms of what you need to do applying for an NHS job. And I work in the NHS, so most of my tips are around how you apply for jobs in the NHS. Also, I am doing a video on my experience of going for a band 9 job in the NHS that I will be putting on soon, so do have a look at that, and just good luck. Hopefully I'll see some of you soon working with us via this route via this route. So that's it from me. I want us to be bold and brave together in 2022, and I will see you on the next one. But don't forget to subscribe. If you found value, please ask some questions if there's anything you want me to expand upon. Take care. Bye.